I'm Dr. Surbhi Chaturvedi from Department of Neurology at VSH Hospital. Stroke is a focal neurological disorder causing neurological symptoms due to any kind of injury to the brain. Stroke can be of two types, ischemic stroke and hemorrhagic stroke. In hemorrhagic stroke, one of the blood vessels ruptures, causing bleeding in the brain. In ischemic stroke, one of the major vessels get blocked due to clot from anywhere in the body, causing neurological symptoms. People who have risk factors have higher chances of having a stroke. Risk factors can be modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are risk factors that can be altered, like hypertension, diabetes, any kind of cardiac illness, lack of exercise, lack of mobility, obesity, drug abuse, alcohol, smoking, dyslipidemia. Non-modifiable risk factors are risk factors that cannot be changed, like family history, ethnicity, race, gender. Stroke symptoms can be summarized as B FAST, where B stands for balance. You have to check whether a person is having any difficulty in maintaining balance in walking. E stands for eye, which means any kind of vision abnormality. It could be the loss of vision from one eye. It could be the loss of vision in one vision field. F stands for face. You have to check whether there is any facial deviation or drooping of one side of the face. A stands for arm. You have to ask the person to lift both the arms and see if one arm is weak or there is a drift from one side of the body. S stands for speech. Speech abnormality could be of multiple forms. It could be slurring of speech, it could be difficulty in forming words like difficulty in speaking, or it could be difficulty in comprehending, means difficulty in understanding. You have to ask the person to speak a word or a sentence and check whether speech is slurred, whether he is able to comprehend what you have asked, and whether he is able to answer correctly to that question. T stands for time. Time is brain in stroke, so you have to hurry up. Every 1 minute, 1.9 million neurons die if stroke is left untreated. So if you see any person having any of the above symptoms, you have to rush to the nearby hospital where stroke facilities are ready. If you find any person having any of the stroke symptoms, you have to rush to the hospital immediately. In hospital, immediately CT will be done to differentiate between hemorrhagic stroke and ischemic stroke. If there is no bleeding in the brain, then clot busting drug will be given to the patient if they present within 4.5 hours. This 4.5 hours is a very important window, because if we give this clot busting drug after 4.5 hours, we do not know whether it will benefit or not. In fact, it may harm them more, as the clot will get more accumulated, more strong, and the risk of bleeding will increase in the brain. So rush to the hospital immediately. And if somebody presents within 24 hours, we do CT angio of brain to check major vessels. And if any of the major vessels are blocked, we can do angiography followed by removal of the clot from that vessel. The older you get, the more prone you are to have a stroke. The risk of stroke doubles every 10 years after the age of 55. But stroke risk is there in young patients as well. Every 1 stroke in 7 people happen in young patients who are younger than 55 years of age. That accounts to almost 10 to 15% of patients with stroke. Even after recovering from stroke, you are not out of woods. The risk of stroke recurrence is highest during first year, which is around 10%, and it increases to 15% in next 5 years. That is why evaluation of stroke and appropriate treatment is needed. If it is an ischemic stroke, proper blood thinners has to be added. If it is an hemorrhagic stroke, along with adequate management, risk factor management has to be done. So even if symptoms have resolved completely, you have to consult immediately. Any kind of transient neurological symptoms mimicking stroke could be a TIA. TIA is a transient ischemic attack, which means symptoms had come. There was a clot that had blocked the vessel. It got dissolved and symptoms have resolved back to normal. However, 1 in 3 people continue to have a big stroke in next 1 month if TIA is not diagnosed, if TIA is not evaluated and not treated appropriately. Like, we have to find the risk factors. Suppose if atrial fibrillation is there in the heart, where rhythm of the heart is not regular, those patients should be immediately started on anticoagulations, which are very strong blood thinners, to prevent another episode. If left untreated, they will develop a big full-blown stroke. Hence, it is important to consult immediately, even if symptoms resolve back completely.